Hello and welcome to Pregnancy Info. Today we will discuss the ways to improve the sperm count and the quality of sperms. People planning a pregnancy might wonder about the health of their sperm. Now, what can affect male fertility? Then consider steps to help the sperm achieve the goal. What will determine sperm health? Sperm health depends on various factors including quantity, movement, and structure. Quantity. Fertility is most likely if the semen discharged as a single ejaculation contains at least 15 million sperm per milliliter. Too little sperm in an ejaculation might make it more difficult to get pregnant because there are fewer candidates available to fertilize the egg. Movement. To reach and fertilize an egg, sperm must move, wriggling and swimming through a female's cervix, uterus and fallopian tubes. This is known as motility. Pregnancy is possible when less than 40% of the sperm in ejaculation moving, but 40% is considered the threshold. The more the better. Structure or morphology. Typical sperm have oval head and long tail, which work together to propel them. This is not as important a factor as sperm quantity or improvement. Now, what can cause the less count of sperms? Various medical issues can contribute to less count of sperms. A problem in the hypothalamus or the pituitary gland, parts of the brain that signals the testicles to produce testosterone and sperm. Testicular disease, sperm transport disorders. Age also can play a role. The ability of sperm to move and the number of typical sperm tend to decrease with age, affecting fertility, especially after age 50. What's the best way to produce healthy sperm? Simple steps to increase the chance of producing healthy sperm include: Number 1. Maintain a healthy weight. Some research suggests that increasing body mass index or BMI is linked with decreasing sperm count and sperm movement. Eat a healthy diet. Choose plenty of fruits and vegetables which are rich in antioxidants and might help improve sperm health. Prevent sexually transmitted infections or STIs. Sexually transmitted infections such as chlamydia and gonorrhea can cause infertility in men. Limiting the number of sexual partners and always using a condom for sex, or staying in a mutual monogamous relationship with a partner who isn't infected, can help protect against STIs. Manage stress. Stress can decrease sexual function and interfere with the hormones needed to produce sperm. Gut moving. Moderate physical activity can increase levels of powerful antioxidant enzymes which can help protect sperms. Don't smoke. Men who smoke cigarettes are more likely to have low sperm counts. If you smoke, ask your doctor to help you quit. Limit alcohol. Heavy drinking can lead to reduced testosterone production, impotency, and decreased sperm production. If you choose to drink, do so in moderation. For healthy adults, that mean up to 1 drink a day for women and 2 drinks a day for men. Avoid lubricants during sex. While further research is needed on the effect of lubricants on fertility, consider avoiding lubricants during intercourse. If necessary, consider usually mineral oils, canola oil, mustard oil, or fertility-friendly lubricants such as Precies. Talk to healthcare provider about medications, calcium channel blockers, tricyclic antidepressants, anti-androgens, opioids, and other medications can contribute to less count of sperms. Anabolic steroids and other illicit drugs can have the same effect. Watch out for toxins. Exposure to pesticides, lead, and other toxins can affect sperm quantity and quality. If you must work with toxins, do so safely. For example, wear protective clothing, use protective equipment such as safety goggles, and avoid skin contact with chemicals. Stay cool. Increased scrotal temperature can hamper sperm production, although the benefits have not been fully proved. Wearing loose-fitting underwear, reducing sitting, avoiding saunas and hot baths, and limit scrotum exposure to warm objects such as a laptop might enhance sperm quality. Eat Fish. One small study associated higher amounts of fish consumption with better sperm motility. Other studies were inclusive. The benefits associated with fish for sperm health are likely due to their high concentration of omega-3 fatty acids, but the role of fish in sperm health is unclear overall. Fruits and veggies. A study of 250 men who had sperm analyzed at a fertility clinic showed that men who are higher amounts of fruits and vegetables, particularly green leafy vegetables and beans, had higher sperm concentrations and better sperm motility. It's not surprising since plant-based whole foods are high in antioxidants such as coenzyme Q10, vitamin C, and lycopene. These micronutrients have been linked to higher sperm concentrations. Walnuts. In 2012, in a small study, researchers assigned 117 men ages 21 to 35 to eat or not eat approximately 18 walnuts daily for 12 weeks. The researchers analyzed sperm parameters before and after the study period. They found significant improvements in sperm motility only in the nut groups. Avoid processed meat. This is not surprising. Recent studies linked processed meats to all sorts of illness. Processed meats including hot dog, salami, beef jerky, bacon, etc. They are delicious. Yes, bacon can make anything taste better. In the case of sperms, several studies connect eating processed red meat with decreased sperm counts and altered sperm motility. Trans fat. Researchers are primarily concerned about trans fats increasing the risk of heart disease. Unfortunately, the concerns don't stop there. A 2011 Spanish study linked the increased intake of trans fats with decreased sperm counts. Soy products. Soy products contains phytoestrogens, estrogen-like compounds that come from plants. A study of 99 men with fertility clinic in Boston concluded that excessive soya intake might decrease sperm concentration. Pesticides and bisphenol. Honestly, they are probably the scariest on the list because they are not foods, but they still end up in what we eat. Plus, they are everywhere. Obviously, pesticides end up on vegetables and fruits. Both BPA and chemicals within pesticides act as xenoestrogens, chemicals that mimic estrogen, just like the phytoestrogens in soy. Xenoestrogens can wreak havoc on sperm concentration. High-fat dairy products. Milk may do a body good if you don't include sperm as part of the body. The Rochester Young Men study, an analysis of sperm and diet from 189 men between the ages of 18 to 22 showed that high-fat dairy products, whole milk, cream, and cheese were associated with decreased sperm motility and abnormal sperm shape. So, this is all about how we can increase the number of sperms and also the quality of sperm. If you find this video useful, like it, share it, and also subscribe our channel. Thank you.